Welcome to the office. Hi, Kimberly.
Hello.
Welcome.
Thank you.
Where are you coming from?
From Baltimore.
What part of Baltimore?
Downtown, downtown in the city.
Okay. What are you doing here from Baltimore?
I'm out of alignment. I had a bad accident during COVID.
Okay.
I was riding my bike with a friend and I fainted and crashed to the ground. And I damaged my tailbone and my buttocks, and I've been crooked ever since.
Okay.
It was my thyroid.
That's what they found?
Yeah, so I had a parathyroid surgery.
Parathyroid. Interesting.
I got rid. They took one out.
Okay.
The bad one.
How many parathyroid glands are there?
4.
4. I was going to ask them a question. That's okay. And the parathyroid sits right on top of the thyroid.
Yep.
So I'm sure you learned all about it.
Yep, they went down through my lips and got it. So that's why I don't have a scar.
Okay. But you said this happened COVID time.
Yes.
Okay. What happened before COVID time? And what are you doing here?
Well, I'm in pain.
Okay. There's nobody there? You haven't seen anybody for any of this?
Yes, I've seen orthopedic doctors, and
Okay.
they're just like, you need surgery.
Surgery for what?
Hip replacement.
Okay. Left side, right side, both sides.
Well, they said start with the left
Okay.
because my feet turn in.
Both feet.
Both. The left is worse than the right.
Okay. All right. So you're here for the alignment pain, and we need to evaluate, see what's going on with the hips.
Yes.
Okay. Fair enough. Anything else?
And I have tension in my jaw. I had a car accident in 2017,
Okay.
and I had whiplash, and I was left with some headaches and tension in my jaw. So I've broken a couple of teeth, so I had to get implants and on and on.
Okay. So we have a few things to go over.
Yes.
All right. Let's go over your x-rays.
Okay.
Let me explain first all the stuff that's going on.
Okay.
Then we'll examine you and figure out where we're going to start. All right, so this is looking at you from the back. Let's put this. This is right. This is right. This is your side. And let's first talk about this x-ray, okay? And let's talk about the foundation. You've watched videos. You've heard me speak. You heard me go over x-rays, not just watch cracks, right?
Right.
Okay, so we have a few things going on here. Let's talk about the foundation. Do we have a level base and foundation? No, we don't. We have a rotated sacrum on the left side, drop 5. We have a rotated pelvis. Now, what's interesting is we do have a short leg on that left side, and you were complaining of the left. There's a 9 millimeter measured difference, that's the MD. If we work on the pelvis, then it's actually going to make it worse. So the answer is in the tailbone. Now, you were asking about your hips, right? And do you need hip replacement? So let's look at it. And if we look, I'm just going to move this out of the way for a second, okay? If we look at it, we look at the hips, it's, I mean, there's a little bit there. This is trying to fuse right here. So I want to be realistic about what we're going to do.
Okay.
And I've had many cases like this. And one lady comes to mind. She was from New Zealand. And she needed bilateral hip replacement, but she had a lot of pain. Now, she came to me. We worked on her a little bit. She was out of pain. She didn't have any pain. However, she didn't have the mobility. And she wanted to be able to still, she was an active lady. She wanted to still mountain climb and ski and all this. And she was about 60, 61. So she ended up getting the replacement of the hip. And the difference was we worked on her tailbone, her sacrum. She had a very rotated sacrum, which predisposed all this. I worked on it. She got one done. She came back. I worked on her a little bit more. She got the second one done. I haven't seen her in 2 years. She's been fine.
Okay.
Okay, so I'm just saying that was her case.
Okay.
In your case, if we look here, this is, I mean, it's small, okay?
Yeah.
It's small in there. But my concern is not that. My concern is this first.
Yeah.
Because if the foundation is off and we get replaced with the foundation off, guess what's going to happen?
Right.
Body's going to compensate. And then there's other stuff that's going to show up. Okay?
Yeah.
So one thing we want to look at and work on is the sacrum for you, okay? While
Yeah.
you're here. That's important. Does that make sense?
Yes.
Okay. As we go up, you can see the short leg caused this curvature. It then compensated this way, and it continues. What I'm trying to figure out is you had some old compression injuries in the middle of your back here. Do you remember what that was from?
The only thing I can think of was a car accident.
So if we look here, there are old compression injuries in your mid-back. 1, 2, 3, 4, 5, 6, 7, 8. Around T8, T9 in this area. Does that sound familiar?
Yeah.
Okay. And we'll come back to this. I just wanted to know if you remember those. Let's go back. Okay, so we have the foundation, we have the sacrum. We want to bring that left side up the best we can, okay? And we want to get you some mobility. Now here's the reality, and I want to be, again, I'm just going to repeat that. Can we get the patient pain-free? I have in the past, but then it's the mobility issue.
Right.
And you have to decide that. We'll know after a few adjustments kind of how you respond. And yes, it's going to be spicy.
Okay.
Okay?
All right.
Okay, let's continue on. All right, let's go up. Let's go up. Okay. Right jaw, left jaw. Right jaw deviates AI, left jaw compensates. And you're saying there was some jaw issues as well. Your discs or your capsules are good up there. I'm happy with that. There is a potential occiput issue going on there. Okay, we'll come back to that. Let's talk about the posture. When we're looking at your posture, you can see the upper part of your body is behind the foundation. So I know you get tight across here as well, right?
Yes.
So let's see what we can do about helping and figuring out that posture for you. Okay. Because the hips ain't going to fix the posture.
Right.
Okay.
I'm wondering to what extent my breasts cause me to stand like that.
In terms of what?
Because they're heavy.
Okay, so are you feeling that they're bringing you back?
I feel like I'm compensating.
Interesting. Okay.
You know what I'm saying?
So let's see in a couple of adjustments, and let's see how you feel in your posture.
Okay.
Okay, and how you walk. We'll see the differences, good or bad, and we'll know from there. So the bigger question for me is the T8, that mid-back, those old compression injuries, causing you to compensate more so than the breast that you're saying, or is it both? Okay, I don't.
I think probably that happened well before.
Okay. And when I look at this, I know the tailbone injury was first.
Yes.
Tailbone injury first, the pelvis was after, whatever happened on the pelvis. So 9 millimeter MD, if we can get that up a few under 7, we're in a good place.
Okay.
Then I'm okay if you have to get any other intervention. I'm okay with that. Okay? Being realistic about it, you want quality of life, right? You don't just want pain-free, you want to be mobile.
Right.
Right? Okay. So, are you ready?
I'm ready.
Let's do this. So I'd like you to walk. I'm going to watch you walk back and forth several times. I need to open the back of the gown so we can see the back.
Okay.
Cool? All right. Okay, go ahead and let's go ahead. Now, first thing, let's just examine. You can see she does have that sway back here. This is the upper part of the body. This is the lower part, okay? So the idea is bring your belly button in and up. This is kind of where we want her to be. Okay, right now just be whatever's natural. Go ahead and walk to the end of the room and back several times. Just keep walking. Try to go straight line the best you can.
Okay.
There you go. So you can see she swings that left leg. That's the short leg. And she compensates. Okay. And she's on the outside left foot when she walks. Keep walking. And yes, she favors to the left, so the upper body wants to compensate to the right. You feel that? Okay. One more time. And the other interesting thing about the compensation is when I look at her feet, left foot overall is still good, even though it's planting in the short leg, but the right is starting to form a bunion.
Yeah, that's old. That's from high heels when I was in my 20s.
Oh, is that right?
Yes.
How big were the high heels?
I gave up the high heels.
6 inch, 4 inch?
4 inches.
4 inch?
I'm already tall enough.
Come over here, Kimberly. Starting at the base. How's the weather out in Baltimore right now?
Hot and steamy.
Hot and steamy. I went there once. It was cold. We're driving in from New York, and you can see all that salt.
Yes.
Right? First thing I'm getting is up top, 15 points, C1, left side, atlas. As we come down, T5, left side, 6, 7 points, 8 points. All right. Now let's see what we got here. Oh, you in for a treat today?
Oh, Lord.
Oh, you're in for a treat today. There we are. We're down in the basement. Sorry.
Yeah, I crashed down to the ground.
Ma'am, so you crashed hard, huh?
Yes. I had a
S4, S5.
small labral tear on top of it.
There's pain right now, correct?
Yeah, it's not intense. Like usually some Advil knocks it out.
Advil does? So when someone tells me that and they tell me NSAIDs over the counter knock out the pain, they need to change the oils in their diet. So you want to add more omega-3 oils to the diet.
Okay.
And I'll add it in the video talking about the prostaglandin pathway. I'll add a chart of the pathway.
Okay.
PG1, 2, and 3. PG2 is the bad stuff. PG1 and 3 is the good stuff. Prostaglandin 2 comes from arachidonic acid, red meat, shellfish, dairy, that stuff. PG1 and 3 comes from the good stuff, right? The fishes, the salmons, the white fish. What I'm doing right now is static palpation, and the first thing I can see is a lot of inflammation right in this area here. And as we come down, it starts to disappear in there, but it keeps going. And you can see as I'm doing this, you can see all this reacting. That's all edema on her side. As I go down the side, look, as I do this up here, watch what happens down there. All that's edema. Okay. And let's go ahead and feel. Come back slowly towards me. That's L5. Tender.
A little bit.
1, 2, 3, 4, and 5. Yes, 4
4
or 5.
5.
5. Down lower. Right
There.
there.
Yeah.
That's 5 coccyx area. Okay.
Yeah.
Let's check the hips. Feet together. Open and close your knees with your feet touching, please. Open and close. Right side only. They're both stuck. Left side only.
Yeah.
Okay.
Left is really stopping.
Okay.
Oh, there.
That's L5.
Yes.
That's S5.
Yeah. Oh, yeah.
That's the coccyx.
Yeah.
Coccyx 5, 5. 1, 2, 3,
5.
5. 5, 5, 5, 5, and 5. She got the triple fives. You're going to Vegas this weekend.
I need to.
You're going to Vegas this weekend. Let's go ahead. Scoot forward just a little bit, please. And scoot back for me. Oh, forward a tiny bit. Sorry. There you go. Right there. C1. Head down, please. C1.
Yep.
Right side, left side. Okay. All right, my dear. Let's turn and face that way. Let's just turn and face that way. And let's make a game plan. Okay. Ready? Okay. We'll start with the neck.
Okay.
Let's get the messages down first from the brain.
Okay.
Then we're going to go on the gray table, start in the basement. Okay? All right. And then we'll go from there.
Okay.
Okay. You ready? Let's do it. Let's bring this back. Okay. Nice and easy there. Nice and easy there. Nice and easy. C1. That's the home run. Just from that, Kimberly, go ahead and stand up. And I'd like you to walk again, please. That's set really nice. Come over here and let's walk. Yeah.
That's crazy.
Tell me what's different.
My leg doesn't want to swing as much. That is so crazy. How is that even possible?
You had a lot of upper cervical cord pressure, okay, or upper cervical pressure. And when there's pressure up here, think about it. Do I have my model here? It's downstairs, no. But we can use this one, okay, and watch. So this is the upper cervical, the atlas. There's the spinal cord right there. So when there's pressure on the spinal cord, there are tracks there. And the tracks, I'll show you, I'll bring some charts. And there are tracks there where the upper cervical can also affect the lumbar. It can affect the thoracics, it can affect the cervicals. So.
That is crazy. My leg doesn't feel like it wants to swing.
Keep walking. Crazy.
That is crazy.
Crazy.
That is crazy. I feel like I can walk straight and plant both feet properly.
You are. That's what's crazy.
That's
not just
crazy.
That you can feel it, but you can. That's cool. Awesome. Shall we continue?
Yes.
Well, that's why you came here, I think.
Yes,
right?
I did. I flew all the way here for this.
I appreciate it. Okay, come on over here. We're going to do coccyx, left side down, and then sacrum right side down. Go on your left side. Left side. Head over here.
Okay.
I'll be on the outside, okay? Because I got to be down low. Now, all I need you to do is hook that ankle. Okay, I'm going to roll you towards me. Roll with me. There it is. That's a piece. There you go. I know. Come on over. Let's go on the high-low.
Oh boy, this scary chair. This is a scary one.
What are you talking about?
I'm sweating.
Already? I just got started. Okay. Baltimore. You like the Oreos? You like the Oreos?
No, I'm a giant. I mean a Yankee.
Easy, easy. Drop the shoulders, okay?
Ah!
Gotcha. I gotcha. I'm holding. Nice. Okay. 4, 5. T5. Gotcha. You good?
Yep.
Cool. I'm going to bring you up now, okay?
Okay.
Now the interesting thing on that, there wasn't a big crack there, but it's set. And
I didn't feel the crack.
What? Walk it off. Check it out. It's set. I crack jokes. I set bones. Walk it out. Crack. I didn't feel the crack.
I didn't, but I felt
The movement.
the movement, yes. But it didn't crack.
Keep going. What's different?
I feel no pain in my upper rump.
Have a seat. Let's rescope you.
And my sciatica feels not there.
Let's turn it this way. There you go. Have a seat right there. Okay. Hi. Starting at the base. Upper cervical is clear. T5 is clear. Check it out. All clear. Sweet. Now, let's go ahead and feel. No, I gotta feel. Oh, check it out. Come back slowly. 5 we're gonna get to. Check out the tailbone now, sacrum. Pretty cool, huh?
Yeah, it doesn't hurt.
Open and close your knees, feet touching. A little different.
Yeah, I feel like I have more width to open.
Right side only. Left side only.
That's still tight, but
Yeah.
that's just the joint.
Different, right?
Yeah.
Cool. Shall we continue?
Yes.
Ears.
Oh.
Hi. Now, let's work on the jaw.
What does cracking the ears do?
So there are 3 bones in the ears, okay? The incus, malleus, and stapes. And it basically, by adjusting it, not cracking them, adjusting it, we're going down and out. It's opening up and getting the movement in the semicircular canals going. So it's good for balance. It is good for hearing. And I enjoy it. Let's turn that way. There you go. Let's use the condyle block all the way back. Look up a little. Slowly open the jaw. Close. Slowly open. Right side comes out. Left side compensates. Open all the way. Open. Close half and hold. Hold. There you go.
Whoa.
Hi. Come back towards me, please. There you go. Open. Voila. Close. Open. Close. Open all the way. Slowly close. There you go. All set. Kimberly, that's where we're going to start, okay? C1, T5, S5, Coccyx. Now, open and TMJ. Different?
Yes.
What's different?
It feels like looser.
Open, close. And I'm watching my fingers as she opens. They feel a little bit more symmetrical. Okay. Last thing, let's go ahead. Now you get the buff and polish.
The buff and polish.
The buff and
I don't know about that one.
The buff and polish. It's vibration therapy, okay? There you go.
Yeah, I know about this one.
Let's get through a few adjustments. You're here for a short period of time.
Yes.
I may see you a couple of times in a week, typically with traveling patients.
Mm-hmm.
Okay, we'll get as much done as we can in the time you're here.
Okay.
Okay. What's really cool in your case was the atlas freed up a lot of it.
This.
Yes, ma'am. C1.
It did. It was immediate. I didn't need to swing my leg.
It's really cool.
And it doesn't hurt either.
Head down, please. 5, 4, 3, 2. Shoulders. Over. Sorry. Around. Over. Around. Let me do the work. Nope. Stand up and face me over here, please. Squeeze. Squeeze. Left hand. You're lefty?
No.
Your left is stronger.
I don't know why.
Elbow. Relax the hand. Relax the hand. Relax the hand. A little more. There you
Ooh.
go. Squeeze.
Oh my God.
Squeeze. Elbow. Lunate. Scaphoid.
Ooh.
Thumb.
Ooh.
Questions for today?
No, this was great. Thank you.
Welcome to the office.
Thank you.
You're welcome. Good stuff. Thanks, Shasha. You want to share? You want to share anything?
I feel a million times better. Like I don't feel any pressure in my hip. It's gone.
You want to test something out real quick before we...
Mm-hmm.
You want to sit on the floor against the wall?
Okay.
However you'd like to sit. Just going down on the floor. Okay. Okay, and the test is not even that, well, that's one test. I know we have limitation.
Yeah.
How's the pain?
The pain is okay. I still feel tightness in my hip.
Tightness.
I feel tightness, but not pain.
Okay, stand up now. It should be easier to get up. I'm not helping you.
Oops.
Take your time. Still should be easier to get up.
Yeah.
Okay. Good. I'll see you
Thank
tomorrow.
you.